My name is Dr. Aseem Malhotra. I'm a London-based cardiologist. I'm also Science Director of a group called Action on Sugar, as well as being Consultant Clinical Associate to the Academy of Medical Royal Colleges. And I've been campaigning for the last several years on tackling the whole issue around lifestyle-related diseases, more specifically the obesity epidemic. And that is I've done that in different ways. I have written some impactful articles for the British Medical Journal, but I've also written regular columns for the Guardian and the Observer newspaper to try and spread the message around the issue of diet-related disease, more specifically around the impact of sugar on health and the fact that it's actually become unavoidable because it's being added to many processed foods, hidden sugars, and this is really the fault of governments to fail to regulate the food industry against their manipulations and excesses. And that's now damaging our health in a significant way. We have rocketing levels of type 2 diabetes, and it's threatening to cripple our health services. So for me, it all started for me working in hospital. So I work as an interventional cardiologist, and I remember a few years ago I had a patient who I treated for a heart attack in the middle of the night, an emergency procedure, keyhole procedure called coronary stenting. I saw him the next morning on my ward round and wanted to talk to him about his lifestyle, about improving his lifestyle. And as I was speaking to him, I noticed that he was being served really food I would describe as junk food. It was burger and chips, basically. And he actually said to me, he said, "Doc, how do you expect me to change my lifestyle when you're serving me the same crap that brought me in here in the first place?" That was exactly what he said. So it kind of made me think, because I was very much aware and concerned about population health and all the statistics and the news stories coming about the obesity epidemic, but also realizing in my own environment, working in a hospital as a cardiologist, and seeing the increasing pressures within our health system. And I love my job. I'm very passionate about cardiology, and it's a real privilege to be able to treat people in emergency situations and save lives. But I'd rather they weren't thrown into the river in the first place, rather than trying to save them from drowning. And in fact, actually, there was a great quote by the late Christian Barnard, which I can relate to, which is when he said that I've saved 150 lives, but if I'd focused on prevention earlier, I could have saved 150 million. So for me, at that stage, looking at all of the issues around hospital food and the fact that we were serving junk food, I started to then look into evidence-based nutrition, something we're not taught about at medical school at all, in fact. I think two key moments for me were writing an article for the British Medical Journal, which was entitled "The Dietary Advice on Sugars in Need of Emergency Surgery." And that was based upon the fact that I realized that the labeling on sugar in Europe and the UK was actually extremely misleading and out of keeping with the science. The labeling on sugar, for example, suggests that people in the UK and Europe should be consuming around 22 teaspoons of sugar per day. But the American Heart Association in 2009 had actually recommended to Americans that actually you shouldn't be, for the average adult male, you shouldn't be consuming more than 9 teaspoons, and for a female 6 teaspoons, for the average 4 to 8-year-old child 3 teaspoons. So I started to look into what the reasons were behind the fact that the nutritional labeling was very perverse, and I realized very quickly that there were huge conflicts of interest involved in behind the scientific guidelines, among scientists, industry influence. I wrote this piece. It got some press coverage. It was front page of 3 newspapers in Britain. It went everywhere. It went to the States. It was picked up in Europe, in Spain, in France. It went to Australia, China, India. It was covered. I did interviews for CNN, Fox News, the BBC. So I was really kind of overwhelmed with the response. But you know, the science was there, had to back it up, and I think since then there have been 2 big studies since then that have actually backed up what I've said, specifically that saturated fatty acids that come from full-fat dairy may actually be protective and certainly aren't linked in any significant way to heart disease. So one thing I think that's really important for me, and it's a mantra that I've conditioned my way of thinking when I eat food, and I'm a big foodie. I love cooking food, I love eating food. Food is so important for so many things, is that food can be the most powerful form of medicine or the slowest form of poison. And it's absolutely true. The scientific evidence actually shows, and I presented this at the conference, that the most powerful coronary intervention tool that has been proven from randomized controlled trials to reduce the risk of death, heart attack, stroke, even cancer, is a high-fat Mediterranean diet. And just to give you perspective, adopting a high-fat Mediterranean diet after a heart attack is almost 3 times as powerful as taking a cholesterol-lowering statin for reducing the risk of death.